What would you do in these situations?
Hey Phil, you alright?
Will you keep a level head and remain calm? Remember, always look for danger, otherwise you might be in danger. Will you react quickly and get medical attention? Do you think that first aid should only be done by a certified first aider? First aid is about being there to give comfort, controlling a situation, and doing all you can before the ambulance arrives. Hi Jim, my name's Ian. Have you got chest pain? Hi, I'm Ian and I've been a paramedic for almost 10 years. Some people think that if they're the first on scene of an incident, they're of not much use unless they've done a first aid course. Rest assured, this is definitely not the case. Sure, doing a first aid course will give you great information and is recommended, but somebody with a level head and knows the basics is of vital importance.
What is first aid? First aid doesn't necessarily mean rushing in with a defibrillator or performing CPR. First aid is just that. It may mean doing something as simple as clearing an area of any danger, calling 000 or helping a person into a safe area. It's also very important to let the injured person know that you're there for them. DRABC. DRABC is a well-known first aid acronym. Danger. Assess the situation and ensure there is safety to yourself, the casualty and other bystanders. Response. Is the patient responsive? Can they talk to or look at you when you ask them a question? Airway. If the patient is not responsive, check the airway. Breathing. Are they breathing or not? Circulation. Check for a pulse at the neck or wrist. In performing some of these duties in the acronym DRABC, you will need to be trained by a professional.
But of all these steps, by far the most important to you in a first aid environment is that of danger.
Before entering a situation, it's critical you ask yourself, can I potentially be in any danger myself? Possible hazards could include vehicles, moving machinery, animals or electricity, to name a few. Remember, you're of no help to the injured person if you put yourself in the same danger or worse. Some first aid basics. Controlling blood flow.
Uncontrolled or excessive bleeding can lead to shock, but in most cases the bleeding can be controlled and stopped before the ambulance arrives at the scene.
To control bleeding, cover the wound, apply pressure and encourage elevation if possible. Bandages hold the blood on the wound, and if you don't have any, then a towel works just as well. If bleeding continues, do not remove the first layer, add another. Burns.
Treating a burn begins with stopping the burning process. Depending on what has caused the burn, such as chemicals, sunlight, or even cooking agents, may just require removing the patient from the scene to a safe environment.
Cool the burned area with tempered running water for at least 15 minutes. While the ambulance is coming, continue running water over the burned area. Broken bones. If you suspect a broken bone, get ice and apply to the injury. This will reduce swelling. However, do not apply ice directly on the skin. If the extremity is deformed, make sure you can leave it in the same position. Do not try to straighten it yourself. Getting help quickly. Dialing 000 as quickly as possible in an emergency is very important. When you dial 000, the operator will always ask you if you want fire, ambulance or police. With ambulance, some basic questions will be asked. For example, what is the address of the incident? Number of patients? What is the problem? And they may give you advice about what you can do to help before an ambulance arrives as well. After calling 000, it may take a few minutes for the ambulance to arrive. It may feel as though you haven't done enough, but rest assured you're on the right track just by being there for the patient.
First aid is a situation we can all find ourselves in, whether we've done a first aid course or not. The most important things to remember are to remain calm, to remove from danger, and to get help quickly.